In volleyball players, you see similar injuries to what you see in the basketball players. There you might be dealing with more chronic, recurrent issues such as shoulder problems, knee problems, more like patellar tendinitis, because they do so much of the jumping activities. So you might be seeing some of those more chronic issues.
In volleyball, I tend to see a lot of tendinitis at the wrist. It tends to be on the thumb side of the wrist, and it has to do with the forceful deviation of your wrist towards that thumb side. Additionally, obviously in setters, we see a lot of finger fractures, finger injuries.
And the most common injury would be an ankle sprain, most common acute injury. And then many of the players have lots of overuse problems that they're just contending with that don't really count as injuries since they're not sitting out. That would be shoulder tendinitis, patellar tendinitis involving the kneecap. So the initial treatment for stress fracture is rest or relative rest. We have to keep the athlete pain-free. Certain stress fractures are more likely to have a harder time to heal. Some of them need to be immobilized. So for volleyball athletes, it is stress fractures that they get from too many jumps from landing. So sometimes foot, sometimes leg stress fractures. So the best jumpers are the ones most prone to injury because their fast twitch fibers are so effective at generating lots of force. Then they get higher up, so they land from a greater distance, and that's what predisposes them to injury. And that's why it's important to teach them to land correctly. Volleyball players spend a lot of time training to jump higher. They don't think so much about landing, and actually correct landing technique should help them to jump higher as well.